All right, so with any breast augmentation, there's lots of different choices available. Most manufacturers will have a whole booklet filled with different sizes, different shapes, and different texturing. And the way I would normally break them down is we look at the difference between a round or an anatomical based implant. Anatomical is also called teardrop, and all of those implants share a lot of similar characteristics. Typically they are a silicon fill, meaning the outside is a silicon shell, the inside is also a silicon-based gel. A lot of people will call them a gummy bear, and that's because it's a cohesive gel. So similar to what a gummy bear feels like when you pull it apart, it's very similar to the way some of the breast implants feel. They feel like a gummy bear. So that term gummy bear just covers the cohesive gel that's present inside of the breast implant. So when we talk about shape, shape is a really important thing when considering breast augmentation. Everybody has different goals. Everybody has different ideas in mind of what they want out of a breast augmentation. A round implant is a very nice, straightforward, and easy implant to insert and take care of afterwards. It's really good for a simple primary breast aug in a young, fit, and healthy woman. Whereas a shaped implant has some benefits. They tend to be less obvious at times, depending on the shape of the implant and a few other factors. But as a general rule, the shaped implant gives a more natural appearing look, whereas the round can be a little more obvious. How obvious you want that breast implant to be is really based on something called projection. So projection is a concept that talks about how high the implant sticks out, or how high it projects off of the chest. Most manufacturers will have a range of projections, and those projections can be low, moderate, high, or extra high. Some people call them ultra high, various other terms along the way. But as a general rule, those are the four ranges that we would use. That also applies to shaped implants as well. As we move up that scale, the higher the projection, the more obvious the implant is. Most women for a primary breast aug would choose somewhere between a moderate or a high projecting implant, depending on what their goals are out of the augmentation. The fewest number of implants that I would use would be in the low or in the ultra high. I tend to find that the ultra high implants are a little too obvious. They tend to be very, very high on the chest, and they do tend to be that appearance of being very large. A low implant I would generally use not in breast augmentation. That's more of a breast reconstruction type implant, and they provide a projection that is really sort of just satisfies a mild discrepancy between the left and the right, and it's just a very small implant that fixes that asymmetry, mild asymmetry. So typically for a primary breast aug, we usually go somewhere between a moderate or a high. A lot of people focus on volume. Volume for breast augmentation is the last thing to think about, or the last thing to worry about. Shape is by far the most important thing to consider. If you walk into a breast augment thinking you're going to get the biggest volume possible, it's the other way around. You actually want to focus on shape. So do I want something a little more obvious? Do I want anatomical? Volume is strictly based on the shape of somebody's chest. So the implant, when it goes in, is different for everybody based on the size of the chest wall, depending on the size of the pocket we're going to be making. Volume is a secondary thing. If you want to go moderate, high, or ultra high in that projection, that's where you start adding a little bit of extra volume. On average, most women will find themselves putting an implant that's somewhere between 300 to 400 cc's. And then as we increase the projection, then those cc's start to increase. So walking into a breast augment with the thought that I want to get the biggest breast augmentation possible, or I have a very specific volume in mind, the best way to think about that is I want a shape in mind, and to come with a few pictures that you've picked out and photos that will demonstrate that shape that you're going after. That will better provide an idea of the projection and shape of the implant that we're looking at, and the volume that we get for you is specific for you. So you can imagine somebody who is 160 centimeters, 45 kilograms, and they're very, very, small, petite. They're not going to need a big implant. But somebody who's, 180 centimeters, who has a very wide chest, they're going to need a larger implant. So they can get the exact same shape, but one will obviously need a larger implant. So going into with that thought that I want a very specific volume is not the way to do it. So when it comes to shape, shape is paramount. So I'd always think you want to go into it with an idea that you want something that's more rounded or slightly more obvious. Then a round implant is what you'd be looking at. If you want to go for a very natural look, then we'd go for something along an anatomical or a teardrop style implant.